Hey guys, it's Sarah here. In this video, I'm going to be going over pneumonia. Pneumonia is a very common topic, which will probably be in your exam, because unfortunately so many people are diagnosed with pneumonia yearly. What is pneumonia? So in general, our body has immune system. We have defense stuff set up so that when something comes in our body that shouldn't be there, our body fights against it. And we have multiple stuff that protect us, starting from the cilia in our nose all the way down, that protect us, that stuff shouldn't go to the vital organs. But when someone has a weakened immune system or someone's ill, they're at risk for it bypassing that whole immune system. And this is what happens with pneumonia. You have a bacteria, a virus, a sort of pathogen that gets into the body when you breathe in through your mouth, through your nose, and unfortunately it bypasses the whole immune system and gets down to the alveoli, to the lungs. And what happens when you have a pathogen in your body? The inflammatory process kicks in. Inflammation leads to fluid leaking in to the cells. So this is what happens in pneumonia. Bacteria comes in, inflammation, fluid leaks in, and you have fluid in your lungs. Pneumonia is fluid in the lungs. So who's at risk for this? The people at risk, like I said, are people with weakened immune system, the young, the old, someone with lung problems, someone who immunosuppressed, and people who have other infections going on in the body that the immune system is not as strong. So how are they going to present? Because it's fluid in the lungs, you're going to have all the respiratory system symptoms, like shortness of breath, chest pain, just because it's in that area, and every time you inhale and exhale. You're going to have productive cough because there's fluid there trying to cough it up. And you're going to have irregular systemic symptoms, fever, fatigue, etc. So how is pneumonia diagnosed? Well, it's diagnosed how they present themselves. You're going to see those symptoms. You're going to listen to their lungs. Because it's fluid in the lungs, you're going to hear coarse crackles. And then, in order to see it for sure pneumonia, you're going to send them for an x-ray. On the x-ray, it's going to show like patchy areas all over, like patchy opacities spread out in the lungs. So how are you going to treat pneumonia? Like we said, it's a pathogen. It's either a bacteria and virus. Could be fungi, but mostly bacteria and virus. If it's a bacteria, you treat it like you treat all bacteria infections, antibiotics. If it's a virus, then we just treat the symptoms. If they're coughing, you give them cough medications. There's different medications you give for symptoms. If they have a fever, give them Tylenol, just symptom management. There are interventions that you could do to assist them, like incentive spirometer to help them deep breathe and encourage coughing. And we also encourage prevention. So to prevent pneumonia, there's a vaccine for people over 65 years old or people who are younger at risk, called the pneumococcal vaccine. We also give the flu vaccine because the number one virus that causes pneumonia is influenza. And the number one bacteria is a streptococcus. So pneumonia is named, if you want to say it like that, based on where it comes from. It's pretty simple. If it's from the community means not in the hospital, and it's community acquired. If it's from the hospital, then it's hospital acquired. But in order to be hospital acquired, it has to be after 48 to 72 hours once they came in. So you can't just come in for a stub toe and then 5 hours later you have pneumonia. It's not from the hospital. So it has to be after 48 to 72 hours after admission. And one type of hospital acquired pneumonia is ventilator associated pneumonia. So when someone's on a ventilator, they have a tube, an ET tube, placed in them. On that tube, bacteria could collect there. And usually they don't have, and they can't cough it up or anything like that. So it goes in, it could easily go into the mouth and they can't cough it up. So it just stays in the lungs, causing inflammation, fluid, pneumonia. And the last category, it could be aspiration. So aspiration pneumonia is basically you ate something, you ate a hot dog. In general, you chew the hot dog and it goes down. This time you swallow the whole thing whole. It went in, and now the lungs can't get rid of it as fast. And now you can't get rid of it as fast, so it stays there, and then it causes infection. This could be from food, drinks, gastric contents, anything like that. So that's basically it for pneumonia. As a recap, pneumonia is a bacterial or viral infection that surpasses the immune system, gets into your lungs, causes inflammation, which causes fluid. Now you have fluid in your lungs. If it's from bacteria, you treat it with antibiotics. The virus, you treat it the symptoms. You diagnose it based on how the person's coming, the lung sounds, and x-ray. And it's categorized based on how you acquired it. Community, hospital, ventilator, or aspiration. It's pretty simple if you just break it down. So thank you for watching. Like this video and subscribe. Bye.